using non-stigmatizing imagery and language. In partnership with the local Mental Health Advisory Council, Cook County Public Health and Human Services prepared this informational packet on non-stigmatizing imagery and language for your organization to review and consider when you are reporting events or resources surrounding behavioral health. Our goal is to decrease stigma related to behavioral health, including substance use disorders and mental health, and to have more inclusive conversations about these topics without alienating people in the community. Stigmatizing imagery reinforces stereotypes and prejudice toward individuals by depicting drugs or substance use. This stigma is a major barrier to treatment and recovery for individuals with substance use disorders, and images of drugs and substance use may trigger trauma or relapse responses for individuals with lived experience. Treatment and patient imagery. Stigmatizing treatment and patient imagery not recommended to use. Non-stigmatizing treatment and patient imagery to use. Additional non-stigmatizing treatment and patient imagery to use. Substance use disorder imagery. Stigmatizing SUD imagery not recommended to use. Additional stigmatizing SUD imagery not recommended to use. Non-stigmatizing SUD imagery to use. Law enforcement imagery. Stigmatizing law enforcement imagery not recommended to use. Non-stigmatizing law enforcement imagery to use. Courts imagery. Stigmatizing courtroom imagery not recommended to use. Non-stigmatizing courtroom imagery to use. Jails and prisons imagery. Stigmatizing jails and prisons imagery not recommended to use. Non-stigmatizing jail and prisons imagery to use. Re-entry, probation, and parole imagery. Stigmatizing imagery not recommended to use. Non-stigmatizing imagery to use. Terms to avoid, terms to use, and why. Consider using these recommended terms to reduce stigma and negative bias when talking about addiction. Public communications about suicide. When publicly communicating about suicide, it's important to include stories of hope, help, and healing. Emphasize that this is a public health issue and the public has a role in being there for others who are struggling or in crisis. Use language like died by suicide, fatal suicide attempt, non-fatal suicide attempt, and avoid using terms like committed or completed suicide, successful or failed suicide attempts. Tips for communications. Always promote help seeking. You are not alone. It's okay to ask for help. It's available and a sign of strength. Treatment works. If someone discusses their personal struggles or experiences, it's important to say that they were able to work through tough times because they reached out for help. Language for talking about mental illness. Say he, she, they, is or are living with a mental health condition, has schizophrenia, or living with schizophrenia. Do not say he, she, they, is or are mentally ill or schizophrenic. Say he, she, they, is or are experiencing symptoms of instead of he, she, they, is or are psychotic, disturbed, crazy. General messaging. Everyone struggles at times, but if a problem lasts too long, is too intense, or feels like more than you can handle, reach out for help. It's important to learn the warning signs of suicide, self-harm, and substance abuse. Look for changes in behavior, personality. It's okay to ask for help. It doesn't mean that you're weak or just want attention. Everyone needs help from time to time, and if you or a friend is struggling, you should reach out to talk to someone right away. Trust your gut. If you're worried about yourself or a friend, don't hesitate to act and get help. You don't have to know what is wrong, just that they're in trouble or struggling. Be direct with your friends. Tell them you're worried and why. Ask them how they're feeling and offer to reach out to a professional and/or family member with them or for them. Crisis information to share. Anyone experiencing mental health-related distress, including thoughts of suicide, mental health, and/or substance use crisis can call, chat, or text 988 for free and confidential support. People can also dial 988 if they are worried about a loved one who may need crisis support. If you or your loved one is in immediate danger, call 911. If you need additional information or have any questions, please contact Andrea Orest at Cook County Public Health via email andrea.orest@co.cook.mn.us.